Unit 9. Hospital. Introduction to a hospital. Jordi Pons is a four-year medical student from Barcelona. He has come to Britain on an elective attachment to the Royal Infirmary Edinburgh. Dr. Barron is introducing him to the hospital. Dr. Barron. The Royal Infirmary is the name of the university hospital for the Edinburgh University. It is a general hospital dealing with all types of patients and illnesses, except pediatrics. We have a specialty hospital for that in another part of Edinburgh, the Hospital for Sick Children. You can see some of the departments in our hospital on the design. Of course, there are many others. For example, the Intensive Care Unit, ISU, and the Surgical High Dependency HDU. Jordi, what does the outpatient mean? Dr. Barrett, outpatients are the people who come to the hospital to attend a clinic or have to test or treatment and then return home on the same day. Inpatients stay in the hospital for one or more days. The rooms where they stay are called wards. If a patient's treatment requires only one day, such as a simple operation, they can be admitted to the day surgery unit. Welcome to the Royal Infirmary. South entrance car parks sit empty, visitors and staff. The Symptom Center for Reproductive Health, Gynecology Emergency, Maternity Emergency, Neonatology Emergency, Outpatient Departments, or wards, Day Surgery, Uni and Endoscopy, X-ray Department, Combined Assessment. B. Outpatients. Dr. Berman. The Accident and Emergency Department, A&E, also called casualty, is where patients who are actually ill with a sudden, serious condition come for an assessment and treatment. Outpatients who have an appointment to see a specialist go to a clinic in one of the outpatient departments, OPDs. They have usually been referred to the hospital by the GP, who writes a referral letter to the consultant explaining the patient's problem. C. Inpatients. Dr. Berger. The inpatients in the hospital are admitted in the three main ways. They may see in one of the outpatient clinics and admitted from there. If there is a lot of demand of the treatment they need, as in the case of a hip replacement, they are put on a waiting list for admission. Alternatively, their GP may arrange their admission by telephone because they are acutely ill, for example, with suspicious myocardial infarction, or they are seen in the AES department when the doctors on duty working at that time arrange the admissions. This will happen in the case of a patient with a fractured neck or femur, for example. Larger hospitals may have an assessment unit where patients can be admitted temporarily while the condition is assessed. Jordi assessed? Dr. Darren, yes. Decisions are made about the conditions and what needs to be done to help them. After a treatment is completed, the patient is discharged back to the GP's care. Exercise Unit 9. Complete a table with words from A, B, and C opposite. Put a stretch mark in front of the stressed syllable in each word. The first one has been done for you. Verb admit, noun, admission. Verb assess, noun, assessment. Verb discharge, noun, discharge. Verb operate, noun, operation. Verb refer, noun, referral. Verb treat, noun, treatment. Exercise 2. Make a word combination using a word from each box. Look at C a positive to help you. Accurate ill assessment unit on duty, referral letter, waiting list. Exercise 3. Which hospital department would be most appropriate for the following patients? Look at A, B, and C are positive to help you. A woman in diabetic coma in intensive care, a patient who has just had a radical prostatectomy, have the appendicitis unit, a patient who is to have a skin lesion removed, day surgery unit, a man with a foreign body in his eye, gynecologist emergencies, a woman with a threatened a man with foreign body in his eyes, an accident emergency, a woman with a threatened abortion, gynecologist emergency. Complete the stress form and formation letter for patients. Look at A, B, and C are positive to help you. Information for all patients. When you arrive at the hospital, please tell the receptionist who will welcome you. Check your details and direct you to waiting area. Then the length of your visit will depend on the treatment you are going to have. You may need to have some tests, such as X-ray, which could mean going to another department, or maybe refer to other professionals, such as physiotherapists or dentitians. You may need to visit the clinic if a staff at the clinic want to see you again. Another appointment will be arranged for you. If you need to be admitted for the hospital for more treatment, either as an inpatient or for a day surgery, you will be told when this is likely to happen. If you don't need further treatment, you will be discharged to your GPS care. 9. Hospital. Introducción a un hospital. Jordi Pons es un estudiante de cuarto de medicina de Barcelona y ha venido al Reino Unido en un archivo adjunto al activo del Royal Infirmary de Edimburgo. El Dr. Barrow le está presentando el hospital. Dr. Barry. The Royal Infirmary es el nombre del hospital universitario de la Universidad de Edimburgo. Es un hospital general que atiende todo tipo de pacientes y enfermedades, excepto pediatría, ya que tenemos un hospital especializado para esto en otra parte de Edimburgo, el Hospital para Niños Enfermos, Sick Children. Pueden ver algunos de los departamentos de nuestro hospital en el letrero. Por supuesto, hay muchos otros, por ejemplo el intensivo y el quirúrgico, hasta la unidad de alta dependencia. York, ¿qué significa ambulatorio? Dr. Barrow. Los pacientes ambulatorios son las personas que vienen al hospital para asistir a una clínica para someterse a pruebas o tratamientos y luego regresan a casa el mismo día. Los pacientes internados permanecen en el hospital durante 1 o más días. Las habitaciones donde se esperan se llaman salas. Si el tratamiento de un paciente requiere solo un día, como una operación simple, puede ser integrado a la unidad de cirugía el día de la operación. Bienvenido a la enfermería real. Entrada sur. Parqueo 6 de visitantes y personal. El Centro Simpson para la salud reproductiva. Ginecología, emergencia. Maternidad, emergencia. Neonatología, emergencia. Departamentos ambulatorios. Unidad de cirugía de día y endoscopía. Departamentos de rayos X y evaluación combinada. B. Pacientes ambulatorios. El Dr. Barrow. El Departamento de Accidentes y Emergencias, AIE, también llamado Casualty, es donde los pacientes que están gravemente enfermos con una condición repentina y grave acuden para evaluación y tratamiento. Los pacientes ambulatorios que tienen una cita para ver una especialidad van a una clínica en uno de los departamentos de pacientes externos, OPD. Por lo general, han sido remitidos al hospital por su médico de cabecera, quien escribe una carta de referencia al consultor explicando el problema del paciente. Pacientes hospitalizados. Dr. Barrow. Los pacientes internados en el hospital son admitidos en una de las 3 formas principales. Puede ser atendido en alguna de las consultas externas e ingresando desde allí, o hay mucha demanda del tratamiento que necesita, como en el caso de una prótesis de cadera. Se les pone en lista de espera para su ingreso. Alternativamente, su médico de cabecera puede organizar la admisión por teléfono porque están gravemente enfermos. Por ejemplo, con sospecha de un infarto de miocardio, o ellos son atendidos en el departamento de la ASE, donde el médico de turno que labora en ese momento coordina el ingreso. Esto ocurriría en el caso de un paciente con fractura de cuello de fémur. También los hospitales más grandes pueden tener una unidad de evaluación donde los pacientes pueden ser admitidos temporalmente mientras se evalúa su condición. Jordi, evaluado. Doctor Barro, sí, se toman decisiones sobre su condición, lo que se debe hacer lo que se debe hacer para ayudarlos. Una vez que se complete el tratamiento, el paciente es dado de alta de nuevo al cuidado del médico de cabecera.